Well, welcome to this combined ValueMed and UK drug testing product demonstration video showing you exactly what you get and how to operate a UK drug testing 10 drug workplace screw lid cup test. Packaging that you will receive is shown here on the right. Standard ALLTEST foils with the expiry date, batch number and lot reference on it. Also a list of the included drug tests in the cup. Now if I just remove that for a second and show you the actual cup, we'll come to the card in a minute. This cup design is a standard screw lid cup with the drug test, as you can see just through there, positioned peripherally around the circumference of the test. Now importantly on this test we have a minimum fill level for the sample. You'll see this is quite low, but it is important when the donor is asked to provide the urine sample into the cup that this level is exceeded. Doesn't matter how far up above this it comes, but ideally not too close to the top because you don't want to have any spillage. Now the cup lid just screws on and off and you have a good size sample cup to give to the donor, and that is simply passed to them and they are asked to provide the urine sample ready for testing. We're going to freeze this video now and show you this cup with a simulated urine sample in it and the next step of the testing procedure. This cup has now had a simulated urine sample added to it. If I just rotate it round, you'll see the sample in the base, and clearly it exceeds the minimum fill level for this test. Now, as soon as the urine sample has been added to this test, it will start running. So it's important to bear that in mind for your read times of the test results. I'm going to remove this panel, which is the label panel to view the results, and you'll see already all of these test membranes have started running and most of them are already showing control lines and test lines. So it is possible to read this result quite early if you have got an all negative test. But what we are going to advise is to read it at the correct manufactured specified time, and embedded here on the left hand aspect is your 3-pad adulteration check. Now we've got a temperature strip on this pack as well down here at the base, and you're looking for one of the boxes in between the Fahrenheit on the top and centigrade scale on the bottom to just slowly glow very subtly. I don't think this is going to pick up particularly well on camera, but I've got a box showing here at 92 and 94 and 90, but no boxes above it. It's a very subtle change on these temperature strips. It doesn't clearly give you a bright colour change on the actual temperature, but that passes the temperature check to indicate that the sample is at roughly body temperature. Now the next check to perform is at the read time to check the 3 pads against the corresponding pads on the colour evaluation chart that you've got. Now these tests are loaded with a pH test, a specific gravity test and an oxidants test. So find the corresponding panel on your card and you're looking for a match within the normal range. If I check the pH, yes, that's normal, and the specific gravity, yes, again normal. If you find any of the colour pads on the adulteration test match an abnormal area, that is suspicious that the sample that has been added may have been contaminated or is not normal strength, normal pH human urine. So the adulteration test complete. At the read time, you are now coming to look at the drug test results. The abbreviations for each drug group are shown here at the top of the test strips embedded into the side. So MOP, MDMA, COC, etc. You are looking for control lines as indicated by the top line here, indicated on the results examples as a C. Every single one of your drug tests should have a control or C line showing. The drug test result for each drug group is indicated by the presence of a test line. Now, please note that the test lines vary in colour density, thickness and saturation. Look at the difference between this ketamine line and the THC line. These tests are all screening at different levels of sensitivity and they vary. Any test line showing that the correct read time must be interpreted as a clear and fully negative result for that drug group. So there you have it, an easy to perform and complete 10 drug screen with adulteration and temperature test strip in an easy to perform and read format. Thanks for watching.